tell the world who you are, what you do, what does nanotechnology mean to your work and everything that you are today. Um, Without any further ado, let me introduce my guest today for this podcast. It's our first episode as MRS to launch this podcast. We are preparing for the bootcamp that we'll be holding on August, Nanotechnology Bootcamp. So these are one of the things that we are trying to do to get our word out there, to get nanotechnology to everyone and every stakeholder and scholars to get involved with what we are trying to do. So, ladies and gentlemen, Dr. Stephen Mufamadi, I'm not going to talk about your accolades and everything that you have accomplished. What I'll just do is for you to tell the people who you are, tell them about who Dr. Stephen Mufamadi is. The floor is yours, sir.
Okay. Yeah. I think I just missed some of your statement because of network. If you could address the question again, yeah.
Oh, sorry about that. I was saying, you can just, I'm not going to talk much about your accolades. I'm just gonna give you the platform so that you tell people who you are, about yourself. Yeah.
Actually, like you indicated already, my name is Stephen Mufamadi. I'm actually from South Africa. Actually, I'm the founder of Nabio Consulting. Nabio Consulting is just basically a company that provides a couple of services. We do several types of wide range of consulting services, but our main focus is on nanotechnology, biotechnology, and pharmaceutics. We work with a couple of stakeholders. We call local industry, internationals, and university entrepreneurs, students. So we do a lot of other stuff in the consulting. Yeah, so my background basically is on pharmaceutics. So I did a PhD in pharmaceutics at Wits University, and a couple of some short courses with the University of Pretoria and one of university in Switzerland on a basic on entrepreneurship. So I'm also interested in terms of, although I'm a PhD graduate, I have a lot of passion and interest on entrepreneurship.
Yeah, interesting. That's some interesting work that you're doing.
I don't know if you want me to address more information.
Yeah,
are you there? Are you still there by any chance?
Yeah, I'm still here. I don't know if my network, what's going on with my network. Yeah. Yeah, you can, I don't know, you can go further with what you do, especially in Nabio Consultancy. It's quite an interesting flagship there that you're doing. Yeah. I think mostly
but actually, like I said, in Nabio Consulting.
Yeah.
At Nabio Consulting, like I said, we do a couple of consulting services. But one of the things that we started this year, in the beginning of this year, we started an initiative called Nano Ambassadors, Nanomedicine Ambassadors. Basically, what we do, we recruit graduate students who are either from chemistry or have got a master's in biochemistry, biotechnology, or some nanotechnology, and then we sort of like groom them to with a couple of skills, some of the skills that we're focusing on in science communications. We realize that this is the way there's a lot of big gap in Africa, particularly in creating awareness of what we're doing in the labs. So we create these, these ambassadors that play a role in terms of learning about what is science communications, and we also make sure that they're able to translate our scientific language into a local language or vernacular language as such, because sometimes you find that a lot of people are doing good work in Africa, but because there's no way to illustrate or sort of like elaborate in such a language that people can understand. So we create this platform where our ambassadors go to local radio stations with local languages and to try to indicate the development, particularly in the area of nanomedicines. And then we also groom them in terms of leadership. We allow them to run a couple of projects. We teach them some desktop research, lab research. We also give them a platform for also looking at platform of entrepreneurship. This is some of the area of or other thing that we do with our initiative of Nano Ambassadors. However, we do many other consulting. Like I told you, we do work with the South African Regulatory Authority, which is SAPRA. We do work with the Innovation Hub as a mentor. Basically myself, I play a role in terms of mentoring the entrepreneurs that are in the space of biotechnologies or nanotechnology, such able to assist them in terms of looking at either developing their business, looking at business plans, looking at the issue of market access, and looking at the strategies that they can use in terms of commercialization. So we do wide range of activities within that Nabio Consulting. We also do a lot of this is something that area of our activity. We do a lot of dialogues where we work with government, private companies. This is what we do, a lot of them. We do a dialogues where we either talking about nanomedicines or looking at the area where it's affecting Africa such or our country such as COVID. We do work with the policymaker also, looking at the issue around the policies, if how they fit very well with what people are doing. So yeah, we do many things. We are actually, even now, right now, we're working on a global nano youth seminar, which we're finalizing it right now. So we do a lot of dialogues and all the seminars at Nabio Consultants.
Right.
Yeah.
That's really interesting.
There's a wide range of things that we do. We do a lot of other medias. I mean, like I can't even remember some of the things that we do because there's so many.
That's
Yeah.
You got your hands very tight there.
Yeah.
That's really interesting. We'll talk about the Global Youth Nanotech Seminar at a later stage. I think it's quite interesting. Well, I would like you to tell us what really inspired you to pursue nanotechnology. Like somebody like me would stand here and say, wow, this man, I mean, like we are in Africa. Sometimes when somebody talks about breaking atoms into smaller molecules, and we just feel like, no, those stuff are not for me, you know. So like, yeah, what really inspired you? Yeah, what really inspired you on that regard?
Actually, yeah, I think for me, nanotechnology inspired me in a different way. So I remember in the beginning of when I started to know about nanotechnology, it was just like a foreign language too, just the same like what you're saying, that other colleagues or other people around Africa might be seeing it as like a foreign language as such. But one of the things that attracts me, finding really inspiring, was that when I started to learn that nanotechnology is something that is common in almost everything that we do in our life. It's everywhere in our life, particularly in medicine. Everything that is biological is made out of nanomaterials. So I think that's where I started to get inspired a lot, and I wanted to know more about this, that if there's something at the size of atom, we've got such kind of impact in our life, in our humans, our medicines, and in many other areas. I wanted to know more. So also, I think when I was doing also my master's, I remember when I was very young, I used to be curious to find out when you take
something high level. Your microphone is muted.
Yeah, I think there was a network issue there.
Yeah, I think one of the co-hosts is coming in, so I think that's what
Okay.
interrupted the conversation there.
Okay.
High level.
Hi, Humphrey. Hello,
Yeah,
doctor.
you interrupted. We've already started with having the conversation with Dr. Stephen Mufamadi. But yeah,
Okay.
you can jump in. We were just talking about his inspiration in nanotechnology, why he pursued the whole field and all. So yeah, he quite explained a lot. It's a very interesting topic. It's a very interesting field that needs us young people to get involved and really learn, because it's kind of like a foreign language, like as you have stated, Dr. Stephen, it's foreign language to everyone.
Yeah.
Exactly.
Yeah.
So yeah, when you talk about it, everybody's like, what is he talking about? So I don't know, we can move forward. Now, yeah, let's move forward. Now I want us to talk about nanomedicine, like the whole field on nanomedicine. How does it impact the healthcare in Africa? How are we saying nanomedicine is the key to addressing all the health problems that we are having here in Africa? Can you elaborate on that?
Yeah.
Yeah.
Okay. I think one of the issue where nanotechnology can contribute significantly in Africa, Africa, we have got a lot of challenge. We have got a challenge from issue of electricities.
Yeah.
We still have cities and many places in Africa where they don't have electricity as such. So if you're looking at majority of device machines that people are operating in terms of diagnosing for disease, it requires those kind of connection with electricity, the internet, and all those kind of things.
Yeah.
But what we really know now about nanotechnology is that nanotechnology, we are more able to design a device that could able to assist in terms of diagnosing some of those serious disease such as HIV, malaria, and TB, using just a device without using electricity at all. So, I mean, those are the area where we see such kind of impact of nanotechnology. We also know that I'll talk more about what is happening probably in South Africa, where we're talking about the issue of HIV. In HIV in the past, people used to have to take a couple of medications. You find like you have to take like 5 tablets in one, and it's a bit of a mission for you to take medication in a bulk.
Yeah.
So with nanotechnology, where we can see that it contributes significantly there, where now you're able to make a small drugs or small tablets with combination of couple of drugs in one, which is something that is playing a role there. And we're also seeing that some of this impact also in terms of a prolonged release, instead of just getting a dose daily, where we're finding challenge in Africa, particularly in TB, where people are not complying with the medications. Nanotechnology is also contributing there, whereby now you're more likely to design in some nanomedicine where a person can just like get like one dose, and after like once a week or once a month or once every 3 months, whereby we know this was some of the bigger challenge in our African country, where people are not complying, people don't have resources and stuff like those. So there are many areas where we see nanotechnology making impact. I mean, now we also talk about COVID. I mean, COVID is one of the issue, but we can really see one of the vaccine that making significant impact on how to deal with COVID, either variant or not. It's nano-based vaccines, the messenger RNAs. They're making significant contribution. So there are many areas where we see the mask. People are making masks that are coated with nanomaterials that can be able to protect you from the COVID. And some people are also making disinfectant that are incorporated with nanomaterials. We can really see that with that you're able to protect them, because the advantage about nanomaterials is that they're different from this other method or other materials where you just keeping spraying every day or disinfecting every day. Nanomaterial can allow you to disinfect once. I mean, there was another study which was done in US. I can't remember the detail right now, but it shows that you're more likely to just disinfect your environment with just the material that are made out of nanomaterials, once in every 3 months instead of just like keeping disinfecting every day, which costs a lot of money, you know. And we find this kind of challenge in our African continent, where majority of us use public transport like taxis, buses, and these buses, they are always packed where people need to be protected, and the environment is not safe for anyone. So definitely there are many areas where we see this contribution of nanomedicine or nanomaterials in health so far. So yeah, I don't know if I miss any other thing.
Yeah. I think you elaborated it well. Yeah, there's
I don't know. I'm afraid
yeah. Network. You got interrupted there, Dr. Mufamadi. Doctor.
I'm afraid network. Yes.
You got interrupted there.
Yeah, no, I noticed. Yeah.
Yeah.
But I was saying some of this, like some of tropical, this neglected tropical disease. Like I remember there was a chap from, in a workshop, a nanotechnology workshop previously.
Yes.
There was a chap from Zimbabwe showing that many of these diseases, they are ignored. So they are trying to design something along those lines. So there are many areas where we see a lot of impact on nanotechnology.
Yeah.
In Africa.
Yeah, true that. True that. We're talking about nanomedicine and the impact in Africa, and they are what can we say, the future, what they can do to our health system. And there's quite a lot that you touched on that can be done with nanotechnology, including the current disease that we are facing right now in terms of COVID-19. We currently seeing that Africa is currently on the third wave, and when you see developing countries, they are now getting back to normal. But us here in Africa, we are back. We are just now it is hitting us really hard. So moving forward, in terms of South Africa, because most of your work is based on South Africa, what would you say would be the current state of South Africa in deploying nanotechnology in terms of combating non-communicable diseases and other diseases? Because I understand you do a lot of work in terms of HIV and AIDS, tuberculosis, malaria, and you do a lot on drug delivery, as you have once stated how you are trying to get people to take their medications at probably not frequently, but using nanotechnology to reduce the amount of the sizes of the medication that they take, but they take a longer duration. So what is the state in South Africa? Like how, because I think a lot of countries can learn a lot from South Africa. We can learn what you guys are doing there and try to implement it in other countries. Yeah.
Yeah, I think in South Africa, I would say there was a lot of activity going on at some stage. I mean, I remember I think it was in 2005, if I'm not mistaken, somewhere there was like South Africa introduced something called National Nanotechnology Strategy, where there was a massive investment towards human capacity development, where so many graduates and a lot of focus on the couple of areas. But however, there was not limited focus. The focus was on only HIV, TB, malarias, only when it comes to medicines and some diagnostic. There were more focus on those areas. So there's a couple of stuff that have been done so far, particularly in terms of diagnostic devices. I think a couple of I'll think about institutions like Tech, the CSIR. They've achieved a lot. They probably have a lot of patents, including some of our university. I mean, I graduate from Wits University. They have massive patents that we're all about nanomedicines. So there are many things that have been achieved, particularly more into patents and some prototypes. But in terms of a commercial each of it, we all know that this is a long road to go, but we hope with the COVID vaccine messenger and vaccine technology will open a big opportunity for everyone to start venturing into nanotechnology in South Africa and start looking at the platform for commercializations.
Okay. That's good. That's really commendable. I think a lot of countries we can learn a lot from South Africa and try to implement some of the things that they are having in the pipelines, because I have a hope. We have hope that soon they will break ground in terms of COVID-19 vaccines and other vaccines for other diseases. We are really rooting out for you guys to actually break the ground. Well, when we are talking about breaking ground, we see that there's a lot. Actually, this is what you mentioned on the workshop, on the last workshop that we had on policy of nanotechnology. You talked about.
I think you're breaking. I can't hear you somehow. There's some kind of internet. I don't know. Lebo, can you hear Humphrey by any chance? I think I'm struggling to hear him. I'm not sure if it's my network or what, but
he's not clear.
I'm not clear. Hi, Lebo. Am I clear? Am I clear now?
You're good now. You can go.
Oh, okay. I think my reception here on the network is it's not stable. I'm not sure what's going on. So anyway, okay. Dr. Steven? Doc? You are?
We lost him. He's not in the meeting anymore.
We lost him. What happened? I think it's his network or mine.
He also had network problems earlier, so I think maybe that's what happened.
I think so also. I don't know. Okay, he's back. He's back. He's back. He's back now. Doc. He muted his microphone. Yeah. Yeah, we can hear you now.
Yeah, I'm sorry about the network. Network is one of the challenges. I think nanotechnology should do something about the network issue.
Exactly.
You are still indicating that there's a lot of things that people can learn from South Africa.
Yes.
I wanted to add on this recent compliment that is South Africa have been chosen by WHO to be a messenger hub. You know, I'm thinking transfer hub. So I'm thinking by that we are more likely to see the nanotechnology being in another level. I don't know. This is my just thinking. I might be wrong, but this is what I'm thinking, that the future of nanotechnology in Africa, it's going to be abundant in case if South Africa will have successful in terms of this recently WHO offered of being what called a transfer hub for this messenger RNA technology.
That's really something, and we cannot divorce being hopeful. So it's good to be hopeful. So yes. Moving forward, what I was talking about was we see a lot of research and development being done, especially in Africa. This is what you said on the last policy workshop on nanotechnology that we had, that, you know what, Africa cannot afford to play the waiting game anymore. We need to get we need to get involved. So the question would be, what are your views in regard to the state of Africa in terms of trading skills and innovation? For example, like making vaccines for COVID, because I think that's one chance where entrepreneurs can play and get money out of it, something like that. So what really is the main barrier?
If you can repeat your question.
The question is, what are your views in regard to the state of Africa in terms of skills and innovation? What are the chances of getting into the market of nanotechnology? For example, in terms of selling vaccines, making vaccines that they can sell onto the mainstream. Did you get that, Dr. Steven? I think he's gone again. He's gone. We are really having network problems. You are muted, Dr. Steven. Yeah,
I'm back. I was saying, like, I don't know what's wrong with the internet in the special days, just messing up my day.
It's messing up your day.
Anyway, it's one of those.
Yes.
Very common in Africa.
Yeah. So the conversation was in terms of trading skills. We are trading skills in terms of commercializing, if I could put it in your words. Yeah. What really, in your own view, what are the barriers to all that?
Yeah, I think in Africa, like, one of the things that I've seen, particularly, I would say, particularly in South Africa, what I've noticed is that there could be good investment in terms of research and development, but when it comes to seeding funding, we see little of contribution there, where a lot of research are left in the lab, in the test tube, in our freezers and everywhere there, where I think that's where we need to start picking up there. We need to start picking up what is something that have been done, what are the patents that are already there, and then trying to look at what are the barriers. The barriers for me, like I said, I think the first things, it's a seeding funding. We don't have a lot of investment, the long-term investment, particularly towards the issue of commercializations. The other thing that I think I see as the challenge is I always talk with my friend. I said, one of the challenges that we have with our academic research or academic entrepreneurship, we don't have a lot of we need to cultivate a lot of those kind of skills where students should not think about just graduation. Students must start thinking about doing research with the aim of commercializing it, because without that, then it's one of the bigger challenge. Another area
Lebron, everyone, we are really having a challenge in terms of network. I think Steven also is having a problem, and I don't know, what do you think we should do?
It's fine. We'll just edit out the bits where there's a network interruption, and then we'll fill those gaps with other questions.
Okay, I hope he comes back in so that we finish our conversation. I really hope so, because I think I was left with only 2 questions to ask him, and that would be it. I hope he comes back. Yeah.
It's similar to when you are on your 5th question out of 6.
Oh, okay.
What did I miss? Did you guys mention the boot camp?
Not yet. We were going to mention that the last question that I'm having, it's about the boot camp. The 2 questions that I have, it's about the boot camp, because I thought it would be, I thought it would fall on as the last piece of the conversation.
It's right there.
Yeah, I think.
Has there been of
Yeah, I think he's back. I think
I'm back. Yeah.
We are back. It's really a bad day in terms of network.
Yeah, it's one of those.
Hey.
Yeah.
All right. How far were we? I think you were you were explaining something in terms of trading skills and commercializing. I think you.
Yeah, I was saying like in terms of. Yeah, I was just indicating things that I think for me personally, which are the barriers in terms of commercialization or trading as such.
Yeah.
That without this kind of investment, I was indicating that investment could be one of the challenges, like seeding funding.
Yeah, exactly.
Could be a challenge. And I was also indicating that regardless of whether there's still many other challenges like awareness. We need to increase public acceptance of nanotechnology, because many of us, if you remember when we started coming with this messenger RNA last year vaccine, people were associating with many other things. So we need to pave those areas, to clean those areas, make sure that public understand this concept of nanotechnology. And we also need to buy in terms of industry. You know, I personally believe that if we can have a good relation with the industry, we are more likely to see the success of a lot of success in nanotechnology commercializations. And also, I also believe that countries in Africa need to learn to forge partnership. You know, there are other countries which are very good with certain things, the way other countries good and other things. Maybe some kind of forge or partnership could play a role there. This is some of the things that I have in my mind right now. Yeah.
Yeah, that talking about awareness and the industry playing a very good role, partnerships and all. What would be your view of a platform like African Materials Research Society in terms of closing gaps in in terms of partnerships, raising awareness, stuff like that? What would you think AMRS can play a role in that?
Absolutely, I agree with you. I agree with you. I think maybe forging some kind of like a consortium, you know, if you can create some kind of consortium where, because sometimes what the challenge that we have as I would say entrepreneurs or academic researchers, the challenge is that sometimes we tend to designing something that does not have market as such, you know. And maybe find that the industry is not necessarily interested, you know. That's why they don't want to invest, because whatever we're designing doesn't serve their purpose. So for me, I feel like if we can forge that kind of if African Material Society can forge that kind of, for me, some consortiums where they're facilitating these areas and identify the needs from the investor, because sometimes we need to learn to find out what are the needs of our investors. Because if you don't know what investor they're looking for, we tend to designing whatever we think is useful and to go to investor requesting for top up or funding, and we get rejections because we're not necessarily saving what the investor looking for or industries they're looking for. So I feel personally, African Material Society can play a role there, and forging such kind of either we can call business consortium. You know, I was talking to my friend earlier. I was saying, like, if we were creating something like a business materials where we can have a group of people who are focusing just designing materials. We can have a group of people that are focusing on products. We can play a lot of big role there. So I think whatever you guys are doing, you're doing good work. I salute you for that. Yeah.
I know. Thank you very much. Thank you very much. I hope the whole team and the whole society is listening to what you are saying. Quickly jump on this. I heard that you are organizing a nanomedicine conference seminar next week. Can you tell us about it? What your expectations after it ends? What you guys want to what's your vision on that?
Yeah. One of the vision about the creating this international or global as such international nanotechnology seminar was that we realized that sometimes in Africa we tend not to know what's going on out there.
Yeah.
So creating that kind of platform, we believe that it will give a lot of our future nanoscientists or entrepreneurs to look at what other people are doing, and also to forge partnership. Because we feel like if we to learn to know what other people are doing and how they're dealing with the challenges or on this area of nanotechnology, it will play a role in terms of creating a very paved future of nanotechnology also with the guy, and also to make sure that the guy from international. One of the other things that we are doing, we're not only bringing we're bringing local and international Africa and around other people around the world. The purpose is to try to make sure that people need to know what we're doing in Africa. People always think Africa is just like I always say, if Africa always looked like we were the last players in the game, if it was a match, we'll be the only last people in the game. So we just need to show people that we might not necessarily on top of having our vaccine and everything like those, but however, in the background, we are working very hard to try to facilitate the development in nanotechnology. So maybe somehow we really need investment. If it's investment, if it's partnership, you say this platform will create those kind of awareness to say, we are doing our work, this is what we're doing, and we might require you or request you guys to assist when it comes to other areas like fundings and partnerships and stuff like those. So I think that's that's one of the reasons why we are forging this dialogue. So such.
Yeah. No, that's interesting. It's very, very interesting. Yeah, we wish you well on your seminar, and we are obviously going to be taking part as MRS to listen to the dialogue and what everybody's there to offer, because probably they'll talk new ideas, new solutions, and all stuff like that. Anyway, in conclusion to our conversation, I want you to talk about just your advice to young people out there, but in line with the nanotechnology bootcamp that AMRS is hosting in August. What would you say to a young dreamer who is looking forward to attend that bootcamp right now?
Yeah, I think for me, like I was talking with some of my colleagues, I was indicating that it's very important to look at this as a big opportunity. Many people, one thing that I'd say about many of youth, youth like this tendency of ignoring the opportunity. They're waiting for since someone is a superstar, and now they want to join later. So I think people must learn to think about the opportunity that you guys are creating for our youth here in Africa. So for me, what I advise my colleagues and my groups is that they need to participate, they need to grab this opportunity, because we shouldn't wait for the moment where we see someone in Africa have achieved bigger things. I mean, like one can say Africa, it's just, there's no much, but looking at what's happening out there, in South Africa as an example, we've got a guy like Elon Musk who will grow up in South Africa as such. So for us, for you guys to create this platform, I think that's a platform where it will create a platform for other youth to use it and able to create the innovations and bring it out there. So I don't know. I think for me, that's what I'm thinking about. Like, youth must grab this opportunity. They must thinking about this is an opportunity for them now to act, to voice their opinion. If they've got some ideas, they should use this bootcamp as a platform for them to explore the opportunities and be able to start thinking about entrepreneurship.
That's a good advice. Because I think if a young person is out there listening, they would know that the world is a vast space that everybody needs to participate in to get theirs. You don't have to wait for somebody. You don't have to wait for somebody to get up there, and then that's when you feel like, but why didn't I do that?
They always do this. They always do this. We see them, That's why now we say, also particularly entertainment. If someone bringing like a certain track or certain music, everyone is jumping into that.
Exactly.
That kind of music. So they should learn to grab opportunity while it's still early.
Exactly.
And otherwise they blame themselves. They never use the opportunity.
Well, that's good. Well, in my own view, what I hope is at least young people could treat nanotechnology like they treat music, because this is the future.
Absolutely.
this is the future.
I agree with you.
If it all means all of us jump in it, I am sure that we would close that gap for Africa. Africa can compete with European countries, we can compete with America, we can compete with China, and we can really cut that dependency that we are having with those countries, because we really have a lot of talent in Africa. We really have a lot of talent, and we are hoping that through this boot camp, we would see those talented people coming in, researchers, scholars, and PhD holders coming in and coming to voice out and talk about their ideas and all stuff like that. Yeah. Anyway, Dr. Stephen, I think this would mark the end of our conversation. I think we covered a lot. Yeah. So I don't know if you have anything that you want to say in the end, that you want to say. Yeah.
I think for me, I just wish you guys all the best with this bootcamp. Because for me, I think this is some of the platform which I've been, for the past years, I've been wishing Africa could create them for our youth so that they can harness the opportunity of this nanotechnology in Africa.
Yes.
But I feel like I'm really glad to see you guys bringing this on this platform.
Yes.
It will be very handy. It will play a big role in terms of for youth in area of cultivating the entrepreneurship activity in Africa.
Yeah. All right. No, that's good. I'll be looking forward to your seminar, or I think I'll get an invite for it to come sit in and
absolutely
listen. Yeah.
absolutely
And listen. Yeah.
We'll do that. Yeah.
All right. Let me thank you very much for coming in and sit with us and have a conversation. I wish we could have the whole day to talk, there's a lot. There's a lot that
thank you so much.
There's a lot that we could learn from you. There's a lot personally I would want to keep on asking a lot of questions. But but some other time.
I really appreciate it a lot, man.
All right. No, thank you very much.
Thank you so much, Humphrey.